I did my fellowship at UPMC in Pittsburgh. I did my residency at the University of Utah. My medical education was done at Georgetown University and undergrad at Emory University. I decided to practice medicine really because I wanted to make a meaningful impact on the community around me, and I wanted to gain technical expertise in something. I wanted to be able to work with my hands, and my field of medicine allows me to do that. I chose spine surgery because people with spinal conditions typically are in a great deal of pain and discomfort. They've often lost a lot because of their afflictions, and so I empathize with that. Further, it's a very technically demanding field, and so that drew me in. My care philosophy is I try to treat patients as though they're my own family. My goal is to really help educate people to make the best decision that they can. Whether or not that's surgery, it depends on the patient. I try never to push anybody towards surgery. My goal is always to help people make the decision that's right for them. In my clinic, I typically see patients with all sorts of spinal conditions. Neck and low back are probably the most common. I see disc degeneration, disc herniations, pinched nerves, stenosis, myelopathy, fractures, to a host of other conditions. Any patient who sees me can expect to see warmth and empathy and a treatment philosophy that tries to empower them to make their own decisions for their life. My role in the patient care continuum is really to, number one, educate patients when they come in. Most often people who come in really have no idea what it is that they're afflicted with. Number two, get them to understand what the treatments are out there, whether or not they need a surgery or whether or not they need something non-operative. I try to help them understand what's out there. And then three, if they do end up needing a surgical procedure, to give them that and then help them along, help them in the recovery process and answer any questions that they need. The most rewarding thing about being a physician for me is to being able to make a meaningful impact in the community that you live in.